You know, we've both been working on climate change and mental health issues for a while now. I'm wondering how you feel about what we've accomplished.
Well, obviously it's on a spectrum, and if I look at what our organization, which of course we are interested in, and when I say our organization I mean the Climate Psychiatry Alliance, I'm very, very pleased with what we have accomplished as a number of psychiatrists interested in educating people and advocating for policies. The good news is that there's an awful lot of change, and people are now beginning to wake up and realize. But that said, there still is a lot of work to do to get people up to speed on the dangers we face. What are your thoughts on that?
I think our little ragtag group has accomplished a lot in the last 2.5 years, both in terms of...
Is that how long we've been together?
Yeah.
Wow.
In terms of educating some of our peers in the profession and others in the broader health professional fields, having an impact on higher level policies has been more challenging. Getting the APA, for example, to vote to divest from fossil fuels is quite an accomplishment. Reaching all psychiatrists with this message that we need to be mindful of the coming and looming major public health threat that climate change poses is more daunting.
And to add to that, I think what is really critical that I see is that psychiatrists see themselves as one of the remedies. We have unique skills. We have expertise in the area of helping people through their denial or their disavowal. We can find reasons to hope even in dark times. We understand science. We get urgency. We have all the tools that make us a perfect, this is what we do for a living. We warn about behaviors that are going to hurt us now and are going to be even worse down the road. So I see that as a really important goal for us to accomplish within our organizations. I wondered if you and I should talk a little bit about, we are so familiar with the mental health impacts of the climate crisis and fears, etc. But maybe we should review a little bit for others what we see as the issue.
Well, it might be useful to put that in the framework of the overall agenda that our Climate Psychiatry Alliance has articulated, which is a variant of the word care with 2 A's. So there's the clinical issues that are heat effects, air pollution effects, anxiety issues, and we can embellish that more, but we know that our patients are more vulnerable to some of the life-threatening impacts of heat waves, both in terms of the heat stroke, but also in terms of suicide rates going up and violence rates going up. We know that people are affected by air pollution in all its constituent components in terms of lung disease that is closely related and having somewhat of a symbiotic relationship with anxiety disorders.
And the recent report that psychosis among adolescents has been linked to pollution, as well as neurodegenerative diseases. Now
Cognitive
we know,
impairment.
Cognitive impairment, memory,
Yes.
immune system, all of these things, the physical and mental, being very much linked.
And then there's the big growing problem of people who have not exclusively caused by environmental fears, but that's a big factor, just a general sense of dis-ease, anxiety, all the terms we use for it, psychotoratic syndrome or ecoanxiety and so forth, that we're having to face and psychotherapists are having to recognize and should be asking about.
Absolutely. Someone said, we were at the meeting, the American Psychiatric Association meeting, and I don't remember who it was, but a person said, just as we get a history, an academic history, an educational history, etc., we should get a history of what their experience with nature has been like, to begin to emphasize, in a good way, emphasize its importance.
Yes, the positive things we can do in terms of more contact with nature has a healing impact.
Yes.
It prevents future illness, including psychiatric illness, for children to be more exposed to nature. And then for the rest of this agenda, there are administrative things that we need to have people address that, for the most part, involve paying attention to the fact that the health sector has a disproportionately higher carbon footprint than than is related to their proportion of the economy. And so we have to look at our own house to make more efficient and less carbon wasting what we do. And also the other A in care is advocacy. So advocating for policies, getting organizations to divest from fossil fuels, to keep the carbon in the ground, to promote alternative energy and other methods for people to be moving and staying healthy, so moving naturally, shifting their diets to more plant-based diets, etc.
Absolutely.
And then the R and the E in care are that we have to have more research to focus on both the clinical issues and other things that will demonstrate what the impacts of climate change are and what the solutions can be. And finally,
which may vary depending upon the demographic.
Exactly.
So that's what's important to see what are best policies.
And the E, education. We have, this is a big one, a big nut to crack, so to speak. We have to figure out how do we get to all the medical schools and other schools of health professionals, as well as the graduate training programs and the continuing education programs, to incorporate some clinical and other kinds of content in the curricula about climate and health. We know that they know about it, they want it, but the bureaucracy as well as the content that's there is pretty full, and so it's like it's a zero-sum game. What are we going to take out to put that in?
Right.
But we have to figure out ways to compel people to put some of that in at all those levels of training and all the disciplines.
One thing that we can think of is that some of our colleagues are prescribing park therapy, for example. And if we think that we lead best by example, if we have offices or clinics and hospitals that are energy efficient, and I've said this before, but to call Gunderson Clinic in Wisconsin, I'm a cheesehead myself from Wisconsin, if you call Gunderson Clinic, they will put you in touch with the people who will help you evaluate your institution and help you reduce your carbon footprint, becoming energy efficient. And when you do it in one place, that's the social norm, and it helps to provide the momentum so that people will do it naturally.
Exactly.
And the idea of bringing green into a building, a biophilic design, recognizing how nature heals, and being aware of that, and perhaps if we are doing it ourselves, those who know can influence others.
As well, to encourage the already emerging solutions for those entities, whether it's small practices using an application like My Green Doctor, or larger healthcare systems or hospitals to get consultants like Healthcare Without Harm to work with them. I'm sure that's what Gunderson Clinic used, something like that. My university, Oregon Health and Science University, they've started a sustainability clinic, and I'm sustainability committee, and I'm on that committee, and we're trying to address this whole range, the similar kind of agenda as we're articulating the Climate Psychiatry Alliance. So, and a big piece is the curriculum part.